You are tuning in to McLaren Port Huron Today's Health Program, and in this segment I'm speaking with orthopedic surgeon Dr. Timothy Lukas about causes of knee pain as we age. So Dr. Lukas, tell us about what are the most common causes of knee pain.
So the most common causes are usually, I'll see patients that have either had a trauma, they've had a fall, and they come in with an acute injury like to the meniscus or the cartilage or a ligament, or they've had chronic pain and they have arthritis, wear and tear over the years. So they come in with swelling, pain, and stiffness and all that related to the arthritis.
So osteoarthritis is the most common type of arthritis in people as we age?
Oh, by far the most common. There are other types of arthritis in joints, rheumatoid arthritis, lupus, gout. So there are other things to consider, but by far osteoarthritis is the most common.
And what are the most common symptoms that people present to you with when they have problems with their knees?
So they'll come in, they'll complain of swelling, stiffness, popping, catching, giving out, like they have a trick knee, soreness. A lot of times with arthritis, they'll have chronic night pain, and that drives a lot of people to come in, because when you can't sleep at night, that really tends to wear on people, and that brings them to the office.
And so at what point do you suggest that people see their physician when they're having problems with their knees?
So if you've had an acute injury like a fall down the stairs or a fall, something like that, and things aren't getting better over the first couple of days, then probably a good idea to get that evaluated. Or if you've had chronic, long-standing soreness and it's related to arthritis, but if it's starting to interfere with your function, starting to interfere with your normal activities, whether it's work or whether it's fun activities, then it's time to get that looked at to see what's causing the pain, to make sure you know what it is and make sure that you're not avoiding something that could be fixed and prevent something more extensive down the line.
So how do you diagnose, or what is your process when someone comes in that has some knee pain?
So lots of different things that I do. I start with taking a thorough history, find out where it hurts, when did it start, are you having those mechanical type symptoms, giving out, buckling, swelling. So once I have a firm grasp of that, then I'll examine the patient. I'll look at their motion compared to their other knee. I'll look for swelling in the joint itself. I'll look for other clues, meniscal tears, joint line tenderness. I'll look to see if they have instability issues with their ligaments. And then finally, I'll do some diagnostic testing. I'll do weight-bearing x-rays to look at how much cartilage they have left on their x-ray. And then if I suspect something like a meniscal tear or ligament injury, I'll order an MRI.
I think we have an image here of a normal knee, so can you explain?
So this is a normal appearing knee on the x-ray. So again, you get an indirect idea of how much cartilage is left by the space between the bones, both on the inside and the outside. That represents the cartilage, and this looks pretty well maintained, so this is a relatively normal knee. Having said that, this patient may not have a normal feeling knee. They could have meniscal tears, they could have ligament injuries that you can't see on the x-ray because only the bony structures show up. So that if I suspected those, I would order an MRI to look at the soft tissues.
So if a patient presents with an osteoarthritis, you would be able to most likely identify that through the x-ray then?
For sure.
Okay. Very good. This is really great information, but we do need to take a break, but we will continue this discussion when we return.